Lastly, Cooley, she's the Deputy Director of the Expanded Program on Immunization at the Ministry of Health. And of course, Dr. Alberto Cola, the Deputy Director for the Division of Infectious Diseases and Epidemiology here at the National Public Health Institute of Liberia. So we invite you here today, the Director General will inform the people of Liberia through you about some training, public health issues and events. And so what shall do, and I turn the floor over to the Director General, the President.
Good afternoon, everyone, and thank you for responding to this urgent and impromptu press conference. This is not the first time that we've done this. When the World Health Organization and the Africa CDC first announced this outbreak as issue of continental concern and global security, we then sprung to our feet as a public health entity in August when I took over in order to begin responding. When we had our first 2 cases, we then called a press conference, and it was the same way on a Sunday, a weekend, when we had that press conference. I will first and foremost want to say thanks to the DRDE. Dr. Jito is not here, Alberta is present, the Deputy Director, and the Division of Diagnostics, Public Diagnostics here at Enfield, for such combined, tremendous and rapid work in responding. Adding to that thank is the Ministry of Health, where we have then the county health officers and the county health teams that also then collaborate based on the structures that we have in this public health response. We just came from the lab and we were on this case, the particular celebrated case, if I can put it that way, for the last almost 36 hours now. We have a procedure called a 717 where we intend to handle, receive the information, let's just say address it within 7 days. We shouldn't go beyond that. We are able to address the situation just within 72 hours, less than 72 hours. And so we want to be thankful. That's why we are thankful to all the forces that combine, and this level of cooperation and collaboration is needed. Thanks also to the press for on and off we have been educating each other on what an active case is, what a suspected case is, and we got to grasp those things. And for a very long period, as you will note, there was no misinformation circulating because the president actually grasped what these terminologies were, which were previously then misapplied. So thank you very much in that respect. In this particular situation, with this recent internet circulation of a suspected case and self-proclaimed, which we already hailed, and I will come to that. Again, the press has been very, very, very professional again in dealing with us as a public health medical institution. You didn't go out publishing stuff, you waited. We saw all your calls, we saw all your text messages, and we kept telling you we are addressing it. We are addressing it. Because for us, we address situation based on facts and the evidence. The evidence has to be scientific, and that's what we base on. If we say something is this, we must be able to prove it. And we will not just answer you as you've been relating to us over time. What triggered this press conference particularly is, again, this recent case. For a long time, the Enfield has been responding to the outbreak, which you can attest to. We came from like 1 case, 2 cases, 3, 7, and then we went all the way up to 63 around December. And then we got 7 cases, then it was 70. In the course of time, all of those cases recovered. And in December, just shortly before December, we had a period where we had no case. We had 0 cases in the country. Then after December, we started picking up cases again. We had about 7 cases, also 3 to 4 cases. Again, those cases were properly managed, again, given the kind of collaboration and the way our management system is. We then went to 0 in March. In March, we had 0 cases. Then we started picking up cases again. So to this date, from January 1st, 2024 to May 11, 2025, we have had, and please be careful with these numbers as you've always done, we've had 652 suspected cases. Meaning all the cases that we do, we see that maybe on the skin, from the temperature, from all other symptoms, we say, maybe this person has something that that is circulating around. That's just a suspicion. So we bring that in, we take the samples from that person, and we test them in a lab. So what we receive in the lab, we receive about 572 of those samples in the lab, because not every case we take samples from. So, out of the 572 cases that we tested in the lab, we had a 100% testing rate, because that's why we brought in the lab and that's why we tested. So we brought 572 of those samples of those cases in the lab. Then we tested all 572 of them, giving us a 100% testing rate, meaning before we were like 75%, due to some issues we had, chemicals, what we call reagents. So we were at 75, we were at 85. Then we started improving, thanks to the Africa CDC, the WHO, and the US CDC, and all other partners that have helped in this regard. All thanks goes to the Liberian government also, which for the first time, and among African governments, from our advocacy and other things, from the work we were doing, that has been one of the first governments to put a line item in the budget. And this effort came from, was enhanced by the advocacy of the Health Committee Chair in the Senate, Madam Vapila, and the Health Committee Chair in the House of Representatives, Madam Julie Weah. So we want to give them thanks also. Now, of those 572 that we tested, we got to confirm 78 to this date. So 78 confirmed cases. Okay, as you know, we said that that's the previous 70, 63, 65, right? And then they start adding on. So all of that is that total to this date. To this date that I'm saying, May 11, because we are at May 18 today. So the other bulletin will come up next week, which will then inform us as to other cases. So out of these 78 cases, we only have 1 active, right? So 77 recovered. So to this date, Liberia, to this date, this May 11, has only 1 active case. Now, interestingly and gloriously, from the work that we've done in combination, we have 0 deaths. So Liberia has no deaths. The concern comes when we have cases coming out of countries that we are bordering, and in the region also. Some time ago, for those of you who did not attend one of our NEPRC meetings, we did a comprehensive comparison with Liberia, South Africa, Sudan, DRC, of course, Congo, where we have most of these cases in Central Africa, and Sierra Leone at that time. At that time, Sierra Leone had only just 1 death. Now, if we do the comparison, we have total suspected cases of 652. For the Sierra Leonean bulletin that they put out on the 17th, again, we had our on the 11th. So they are 6 days ahead, right? Our next bulletin is coming up. And you can still compare that with these numbers we are giving you. We just did a comparison last week when we compared them head to head in our NEPRC meeting. There have total cases of 2,559 to this date. And we gave you this slide for your accurate records. We have total confirmed of 78, right? And they have total active cases, total new cases of 130. We have one active case, as we said, right? All of our cases have recovered. And we have one active case up to May 11. And our neighboring country has total active cases at this point of 1,918. And we gave you this so that you have that for your records. We have 0 deaths. Our immediate neighboring country has 13 deaths up to May 17. For us, up to May 11. And certainly we have been following throughout this week. We also have not heard of any death. There have been no deaths reported to us. So we can confidently say this figure remains at that until whatever may change. We have been communicating with the National Public Health Agency in Sierra Leone because of the pattern of transmission also, one of which we call cross-border transmission. We know what happened in our region during Ebola. We know what happened during COVID, but Ebola particularly, when the 3 countries, Guinea, Liberia, and Sierra Leone, were heavily infected. So from that point on, we've had very serious collaboration among ourselves. We, from the National Public Health Institute of Liberia, has been proactively engaging our neighbors. During the course of time, we have visited the Sierra Leonean border, the border with Sierra Leone, at Bo, waterside. We have visited other border points in Ganta as well, along on the Guinean side. We have done a cross-border. We have gone into the Ivory Coast, a program sponsored by WAHO, which is the West Africa Health Organization. And we did some exchange of information regarding how we are treating our cases here, how we are handling our cases, how we are going after them, how we are finding them, sharing our experience with our Ivorian brothers and sisters in the public health and medical arena. So we've been doing this. From the south, the WAHO, which is linked with WHO, there is an effort to also have another cross-border exercise of this with Guinea and Sierra Leone. That is coming up. Until we saw this Mpox situation spiraling almost out of control in Sierra Leone, our neighboring country. So that is the level at which we are cooperating with our neighbors. The director of diagnostics just came in. We did say thank you very much for the sleepless nights. I left him at the lab and I came ahead because of, everyone else was waiting. So that's where we are. What we have done also in collaboration with the WHO, the Africa CDC, US CDC, is to continue increasing and enhancing our surveillance. Because we have to keep looking. Not only looking, but we have to keep testing also. So they have been helping us with the resources also provided by the Liberian government. It has helped us to launch certain other aspects of the program where we don't necessarily have to then depend on the partners solely. That's a very big plus for us. The Africa CDC, in fact, now has taken our model and have been taking it to various other countries to use the way we are responding. Just on Friday, we got a request from, I will not say the country, one of the countries to have us giving them our reporting platform with the data and how we report and how we are responding and how we are managing our cases. So, NPHIL, under the circumstances being evaluated by the Africa CDC and declared as a center of excellence, it imposes upon us that responsibility to deliver. And that's why we have been making every effort to do. So that's one of our immediate responsibilities that we have. We had a meeting. When they requested that at the last meeting, I said, well, I have to talk to the team, and we have to agree on that because of data sharing and all of that. I cannot make a unilateral decision. And we came to a conclusion. So those are the efforts that we are making, leading some efforts, not just regionally, but on the continent as well. That is why, in terms of our testing capability, we want to thank and still, we request WHO and Africa CDC to continue to give us some reagents. Why? Because in our official communication with the National Public Health Agency of Sierra Leone, we have offered our services, our diagnostic services, and we have offered our sequencing services also. As you know, the WHO and Africa CDC jointly were able to, when we came in, create the situation whereby all the machines that we had here for sequencing that were not in use, we didn't have the capacity and all that, we were able to then combine and bring in that technology. So today, Liberia has the capability of sequencing all its pathogens. We're able to detect that we have clade 2A and clade 2B. We tested that right in country. We didn't have to send those samples out, and we don't send samples out anymore. Instead, we're being referred to for samples to come here. So that is a big plus for our public health system. It makes it robust. It makes it efficient. It may not be at the top, but we are making some strides. So, coming back to the case, we have consistently been carrying out awareness in the vernacular, giving our own limitations in terms of resources, and of course, repeatedly during press conferences and public health exercises. We have been explaining to the Liberian people the status of Mpox. We intentionally waited for a while so that we see how the message goes. Because it's a very fine line when you're telling people, we have this number of cases, we have this number of cases. Some people may become so afraid, and you create panic instead of creating awareness. So we've been playing that fine line game, and to the extent that nobody even knew that Mpox was here. Many people. I met with some of our government officials, and they were asking, what's going on with the Mpox there? I said, do you know what the Mpox is in the country? They said, no. I said, but it's here. But we've been handling it the best way possible. Not to create panic, but to create awareness. Now, in the last 72 hours, there was a Liberian celebrity, and I will say celebrity because if it happened in the West, it will be a big thing for them. We overlook our own things here. This is somebody who makes us laugh. For some reason, when you start and you open the internet and he pops up and start to joke, you take that joke and start laughing, you forget about your trouble, maybe temporarily. Nevertheless, those are our celebrities, and we must promote them. Now, see what has happened. We, in recent times, saw the upsurge of Mpox cases in neighboring Sierra Leone. There was a program, an event held there, where he participated and performed. And according to what he explained on the internet, you all got an explanation. I don't need to go through that. You saw what has been circulating. We want to thank him highly. Because why? It takes courage to come up with that. The same thing we've been doing, but we don't have it on us. So nobody, when we say there's Mpox, in fact, some officials have even denied that there is this disease circulating here. And we had to go to some depth and breadth to explain that it is real. It's happening. Don't see because in the DR Congo, the people are going helter-skelter, the numbers are so up, 5,000, 10,000. The deaths are, because it's not happening here because of the way we've been trying to handle it. What we have tried to do is to go ahead of the curve. That's why initially I thank all of the pillars that are involved. I will come to vaccination. So we want to really thank him. We have a well-known celebrity in this building. I'll tell you. I will not call the name. We were talking about the situation some time ago, and I joked that celebrity and I said, because during COVID, I had my vaccination taken publicly, and it was all around as a means of encouraging the acceptance of the vaccine, right? And then in church, I also kind of talked to the church people and all that because we're in church and they were talking about the COVID. So I had to give some little awareness. And we gave these four, what I describe as the four aspects of vaccine acceptance, So where we have the 10 commandments, I mean that the 4 commandments of vaccine acceptance. If you go on the page, you will see it, we won't go into that. So I said, you can help us with some promotion because not only do we work here, but with your thing out there, it will help. And just that, so that they sent me a lot of things, and I saw them, and I said, okay, at some point, we'll raise communication, and then we'll do some videos, So all of that was in process when we had a situation, and this celebrity comedian came out to say what he had, what's happening to him, what he felt, and how it was being treated, and how he was now treating it at home, rocking the chalk and everything. We got a lot of questions. Number one question is the chalk that he put on. He said the treatment for Mpox. I told them where the Africa CDC and the NFIL and other NFIs are heading now. We are looking at not only, Western medicine, but we are going to look and dive into investigating our traditional approaches. Something must be in there, but we have to look at it scientifically. So we don't know, but this is the way it's treated. And so what we did then in this regard was to alert our surveillance officers, the county health officers. We sent the team, the combined team went, we located the patient, extracted samples, took the samples to the National Reference Lab just yesterday. So within these less than 36 hours, we've done all of that. We didn't rest. Early this morning when our group did their part, early this morning we got together and went directly to the lab. We expected them yesterday. The other folks were at the lab. I said, if it comes in, just let me know, and then, the rest of us will come. But it didn't come in, on time. So the samples came in, and many other samples came in. So let us not just say there's one sample. Many other samples came in. And they were tested, and out of the many samples that were tested, we saw that 3 of those samples, were positive. We sent those results out already. Mind you, we have one positive case still, right? One active case. So these 3 added to that gave us now 4 active cases, because those are confirmed. we confirmed by testing. And that testing is called molecular testing for this kind of disease. So that's what we did. Okay. Between now and next week, we'll be receiving more samples, right? So we'll be testing still. So the number may remain like that. The number may increase. But as of today, we have 4 active cases of Mpox in Liberia. We have 7 recovered cases. So the total number we have now, 4 plus 78 is what? 82. I mean, you can help me with it.
Yeah, 82.
No. 82. We have 78.
No, 4.
It's 3. 81 minus 1.
They're covered.
Yes.
Thank you.
So 81. 81. So correction, 81 cases, right? We have today 81 cases. Now, what we are not going to tell you, and I know that question will come, is was that case among those positive? No. For confidentiality reasons, in public health and in medicine, we will not tell you. All we can tell you is among the many samples that we received and we tested, I think about 10 or so, 4 of those samples were positive. So we're only going to tell you, and we are only telling you how many cases we have. Now, what we have decided to plan to do, which has already started, is number 1. You also may have heard that there was a reported case from the military. So these cases that we are talking about is among those. That was already known before these other cases. So that one case you saw there probably may have been that case. And the EPI, the Extended Program on Immunization, the vaccine people. This is the director. What we did also was to ask the Africa CDC and the WHO in meetings that we attended that we need vaccines because the vaccines can also help as a preventive layer. And that was approved, and we got the vaccines in country. We went through all the regulatory things that we needed to do, and the EPI director led that pillar, and we started vaccination. That was just a month, almost like a month ago. Yes, a month ago. The vaccination campaign was launched in Senye. The Minister of Health and I were there to launch it. And we took the vaccine. And we did not cry. So they are witness to that. They were the one holding our hands. So we took the vaccine, and the vaccine acceptance, was very, very good, as the EPI director will explain to you later when I shift to him. So in the case of where we are now, what we are planning is, number 1, because you asked, what are our plans now? We do plan next week to visit the border again. This time will not be just Bo. It will be along the corridor, that belt where we have the cases in Sierra Leone on the other side. So we want to visit that area and enhance our surveillance capabilities. We want to also enhance our cross-border surveillance, meaning on both sides, we want to increase that surveillance. They should be looking with sharp eyes. On our side too, we should be looking with sharp eyes and monitoring things. If for any reason they collect samples in that area that they may not be able to transport all the way to Freetown, Kenema, they can bring them right to Monrovia. We can have them tested here and send in the results. If for any reason they need sequencing to know whether there's any other clade circulating, because they also detected clade 2, we can do the sequencing here very rapidly and send them back the results. It's that kind of collaboration that we have established between the Ministry of Health here and the Ministry of Health there, the National Public Health Agency there, and the National Public Health Institute here. So it's a unison effort, which has been done on the One Health platform. Why? Because what we are looking at is what we call a zoonotic disease. It comes from the animals and comes to us. When it changes the way it wants to come to us so that it can stay in us, that's how it does it. What we call mutation in science, it does all of that, change its genetic makeup in order to adapt in us. So that's how they live from the animals and come to us. And there are many diseases like that, Ebola, COVID, all of those. So that's one thing. We're asking our partners to help out with reagents for testing and reagents for sequencing. We are asking for assistance with surveillance so that more people can be deployed along the border in order to actively carry out this response from our end and from the other end. Whatever the internal situation with the Sierra Leone issue is, we're not here to say, and we don't actually know. We may have discussions and know some of the facets, but it's not our place, for that. We're only talking about what we can do from our end to help the situation. Because if we don't help out, it may spiral out and it may infiltrate and it will come to us. Or it may go to Guinea, come from Guinea, come here. So we are looking at doing the same thing with Guinea as well. So from our Ebola experience, we are basing on that to address the situation in a holistic manner, not just in piecemeal and not just as a selfish country or individual countries, but as a region. So that is where our efforts are. I will turn over to the EPR because what we are thinking also is the strategy that was devised, those that have been confirmed, the people around them, we need to vaccinate them. So where we are coming from, the border along there, we are asking Gavi through this medium to please provide us more vaccine. The official request will come, but through this public appeal, to please allot additional vaccines for us, because it's not just Liberia now, it's Liberia, Sierra Leone, Guinea. So if we are able to handle the situation within this triangle, it will not spiral out of control. We can be vaccinating in Liberia and at the same time in Guinea from what we have decided. So we are also looking at establishing cross-border IMS so that both the Sierra Leonean and us and the Guineans will have one little platform where we'll always meet and discuss and see what's going on in the other country, what's going on here, what are you doing, what can we do together. But if we started doing one-on-one, it will be a little scanty and confusing. So that's our proposal to them in the letter we sent to both the the Africa CDC and our Sierra Leonean brothers and sisters. All of this information will then be transmitted. Everything we have done here will be transmitted to the WHO officially later this week to tell them that these are all the steps we have taken so far. We contacted Africa CDC, we contacted our Sierra Leonean brothers, this is what we are doing in the country, and then they will know how to assist us in whatever we want. So we want to thank all of you again, and I will pass on to the EPR director, who is the head of the vaccination pillar of the National Mpox IMS, NEPRC.
Thank you very much, Gigi, for the intro. On behalf of our Honorable Minister of Health, Dr. Louise Boto, who is currently out of country on official assignment, she's attending the World Health Assembly, 78th General Assembly in Geneva, Switzerland, to bring you greetings from the Ministry of Health. Briefly, before the immunization fellow speaks, I would like to ask the case management, the County Health Officer of North River County, Dr. Tapia Kwali, to weigh in on case management, and then I will follow. Thank you.
Okay, so good afternoon, everyone. So we'd like to express my thanks appreciation to everyone in the press. Thank you so much for this organizing this press. So as the DG said earlier, the case from yesterday, so I'll just take a brief summary from yesterday. We just want to also add my voice to appreciate our celebrity.
Yes.
He has been very cooperative with us. Yesterday, after we received the information, we had some of our colleagues that were tagging us in the video, and we reached out to him. So when we got a call from him, he drove himself where he was to come yesterday at the Liberia Health Center, where he collected his specimen. And then the team was also there from the county that we did the line list, and we got the contacts that he had interacted with prior to this. And then this morning, blessing it from us, we also reached out to him, the team, the psychosocial team, and he agreed to be transported to treatment in a way he's currently at right now undergoing treatment. So we will continue to give you updates as it relates to treatment as we go along. But he's in good hands right now. He's at a treatment unit currently as we speak, and he's undergoing treatment. So I just want to throw light, and also again appreciate him because yesterday it was a bit difficult to get him on board, most especially when it comes to diseases of such nature that will create public panic. We tried to persuade him. He initially said no, but at some point in time we were able to convince him, and he agreed to go with us, and he's currently undergoing treatment. So I just want to throw that light before the EPI come in. So currently, just to inform the public that he's with us, and then he's undergoing treatment at the treatment unit currently, and he's in good hands. But as we go along, we'll update you subsequently. Thank you.
Thank you very much to our county health officer and the case management lead. I would like to just restate the good measures that we can all take to keep ourselves and our community safe. So we encourage all of our citizens to continue the good health-seeking behaviors. Number one, be very observant for any unusual symptoms, specifically rash on the skin, fevers, and headache. Should you identify this in any person, the first advice is to stay away from that person. Next, you should contact the local health authority, and this could be the nearest health facility, clinic, hospital, or medical center, that we have a member of the community who has developed these signs and symptoms. Can you come and help us? The health facility will reach out to you. They will talk to the person who is suspected of having the Mpox disease. If there is strong suspicion, samples will be collected from this person and they will be submitted to the lab. At the same time, all of the other human beings who share a common space will be identified, and we'll call them contacts, pending the official results from the lab. Should we have the results from the lab that comes back and confirm and says, yes, this individual has Mpox, they will be transferring the affected individual to a care and treatment center within the specific locality. All of the contacts who are identified now will then benefit from the vaccine. This is where the immunization payload becomes activated. I must hasten to mention that the Mpox vaccine is a very unique vaccine. Unlike most of the vaccines that we already know we give to children and pregnant women, Mpox is completely different. It is a vaccine that has been deployed in the midst of an outbreak as one of the countermeasures to interrupt the human-to-human transmission. So it will not be given to everybody. It will only be given to contacts of a confirmed case. And these contacts have further specific conditions to meet. They must be persons of age 18 years and above, excluding pregnant women. The second category of citizens who will qualify for the Mpox vaccinations are individuals at risk. There are certain individuals within the community who, because of their line of work, are more exposed, have an increased chance of contacting the Mpox disease. An example would be the health workers who are in the field, who are actively looking for cross-borders and migrants. We have cross-border traders, market women, fishermen, and truck drivers who may, because of their work, wake up in one city and travel to another city. So they are persons at risk and they will qualify for the vaccination. So just a few updates specifically with vaccine. Liberia received this vaccine from the Africa CDC in late 2024. We had to do training for our health personnel. Thanks to WHO who supported the training, we have been able to train the county health team of all of the 15 counties in Liberia on how to handle the vaccine, how to transport the vaccine, how to administer the vaccine, and what to look out for after the administration of the vaccine. To date, we have been able to vaccinate over 2,000 persons across 4 counties in Liberia: Grand Cape Man County, Nimba County, Grand Bassa, and Simon. With the recent information about a confirmed case in Monserrado County, we would like to assure the public that beginning tomorrow, vaccination will be offered to those who qualified for vaccination within Monserrado. Thank you. We can stop, and if there are any further questions or clarification needed, we'll be happy to provide it.
Okay.